This is the audience. Okay, we are all aware that there is an immigration problem in America today, and a large number of these immigrants are coming from Spanish-speaking countries into our country, and most people here are unable to communicate with them because these people only speak Spanish, and many of us only are able to speak English. And this issue is particularly interesting to me because I'm a pre-physical therapy student, and I will be working with patients one day who may be immigrating from a Spanish-speaking country, and they won't be able to speak English, and I will need to be able to communicate with them so that they can get the best care possible and the best care that they deserve. So pretty much I believe that if you're going into the medical field, you need to be able to speak the language of the people that you will be working with. The Spanish-speaking population in 2005 was only 14%, but in 2050 it is estimated that the percentage of people in America that are going to be Spanish-speaking only will increase to 29%. And you might think that people that are coming to our country should be able to speak English, and I agree, this is true, but they might not know English right away, and so we need to be able to welcome them and to help them adjust to America, and so we might need to meet them halfway and learn their language as well. And this issue is going to affect all realms of society. It will affect marketing companies who need to make advertisements that are written in Spanish, and they need to have commercials that are produced in Spanish. Libraries will need to have more books that are written in Spanish, and TV companies will need to have more TV shows that are produced in Spanish due to the growing number of immigrants that are coming in and the higher demand. I believe that the medical field, though, is going to be one of the most highly affected because this is a little more serious when you're dealing with people's health as opposed to books and movies and things like that. There was a study done in Colorado at a children's hospital, and the study surveyed several different doctors, and it did a questionnaire, and the doctors were asked several different questions about their patients' ability to speak English and Spanish and so forth, and only 78% of the doctors that were surveyed were 78% were unable to speak Spanish at all, and the rest were. And this was a large problem because the large percentage of the patients at this particular hospital in Colorado were only able to speak Spanish, which created a large barrier between the doctors and the patients. And when a large language barrier exists, the doctors might not understand the symptoms or the complaints of the patient. They may then wrongly diagnose something or tell the patient that you have this disease or this disease, and they might not at all. And this could lead to wrongly prescribing medications that they might need, they might not need, or they might not get medications that they do need to treat a certain disease. So simply put, a lot of patients in America today are not being treated with the best care possible because they don't speak the same language as the doctors. And you may think that there are translators that are able to fix this problem. And while hospitals do have translators available, the doctors are saying that they are not sufficient. And in the same Colorado study that was done, there was a doctor that was quoted, and he said that the translators take too much time and that they often do not know medical terms and are ineffective. So while these translators might know Spanish and be able to speak it fluently, they may be uneducated in the medical field and they might not know medical terms in the Spanish language, so they are therefore ineffective. So some doctors will just go to other Spanish-speaking doctors in the same hospital or clinic, and they may ask them for help, but in reality this just wastes everyone's time because The doctors are there to treat and care for patients. They don't want to spend their time translating back and forth, and that's not what they're getting paid to do. So in summary, pretty much everyone just needs to take on the responsibility of learning the language themselves and not just use the few Spanish-speaking doctors that do exist for their abilities. And so I hope with my career to be able to use my knowledge of Spanish and physical therapy to treat all types of patients, even ones who are immigrating from a Spanish-speaking country, and provide them with the best care that I can. And if you're going into the medical field, I encourage you to research this more and to think if Spanish is a language that you can be learning as well to better yourself as a doctor. Thank you.